Okay. Assessment of binocular vision and accommodations. Relevant information from case history and assessments of other systems. During a problem-oriented examination, a list of tentative diagnoses is made during the case history, and this is used to determine which particular tests are likely to be useful to help differential diagnosis. The tentative diagnosis list is then updated after consideration of the results from each test of the eye examination. A brief introduction to some of the relevant information in the case history and assessments of other systems to the assessment of binocular vision and accommodation is provided here. Observation and symptoms. A. Simple observations of the patients can highlight a strabismus or head tilt or turn. Parents or carrier may also inform you that they have noticed that their child occasionally has an eye turn or perhaps an abnormal head posture. Any suggestions of a strabismus requires a careful cover test and a stereopsis test in addition to looking for amblyopia and possible cause of the strabismus such as hyperopia. B. Symptoms of blurred vision, headaches, or asthenopia at a distance and or near can indicate a decompensated heterophoria or accommodative insufficiency or excess at that distance. C. Complaint of double visions could suggest a heterophoria breaking down into a heterotropia, typically horizontal diplopia occurring especially when tired. A remote near point of convergence, the angle of strabismus changes so that the retinal image falls out of the suppression area and or an concomitant deviation. An appropriate line of questioning during the case history will help in this differential diagnosis. Beware that children sometimes complain of double vision when they mean blurred vision. Note that cortical cataract and occasionally posterior subcapsular cataract can cause monocular diplopia and should be considered in elderly patients by determining if the diplopia persists if one eye is covered. Signs of or symptoms of fluctuation in distant vision and, in particular, symptoms of distance blur after near work suggest problems of accommodation, and tests that assess accommodative function should be employed. E. No symptoms. It is worth remembering that a lack of symptoms does not in itself mean that the binocular system is normal. For example, patients with suppression or long-standing heterotropia almost certainly will not experience binocular vision symptoms. F. Poor reading ability and poor progress at school could also be due to an accommodation or binocular vision problem. Children especially might not complain because they often think everyone sees the way they do. Binocular vision problems such as diabetes or systemic medication that can affect accommodation or binocular vision. When examining young children with or without a binocular vision abnormality, it is useful to ask whether any member of the patient's family has a strabismus or lazy eye, as there appear to be a hereditary link, particularly for esotropia.